Hey everybody, this is our last set of notes for disorders content. We're going to be switching gears for this unit, moving into therapy content from this point forward. So let's get into the last grouping of disorders, which is schizophrenia or schizophrenic-related disorders. So you heard me make reference when we were doing our depressive disorders content that that is kind of perceived to be the common cold of psychological disorders. So if we're using that same kind of reference or analogy, if you looked at schizophrenia, it's considered to be kind of the cancer of psychological disorders. It is very overwhelming, very, very, very difficult for an individual to be able to function on a normal everyday level. And nearly 1 in 100 people suffers from schizophrenia. And as you heard me give you info on the intro content, schizophrenia is diagnosed worldwide. It's not something that is culturally differentiated. So 24 million people, when we last did a data collection on this information back in 2002, I would argue that there's probably a higher component than that as we stand here many years removed from that piece of statistical data. But it's important to recognize that for many with schizophrenia, the first appearance of psychotic symptoms presents itself at different times depending on the gender. For males, you're going to see your first psychotic break around ages late teens to early 20s, around 18 to 20. For women, you're going to tack on about a decade for that. They're going to demonstrate their first psychotic break at roughly age 20 to 30. It is important to note that while you see more presentation of schizophrenia in men in like TV and things along those lines, it does affect men and women equally in terms of a diagnosis. So when we look at the term schizophrenia, the name literally means split mind. So what happens here within schizophrenia is that there is just this break in a person's level of reality and what they perceive to be real in many respects. There is very disorganized and delusional thinking, disturbed perceptual processes, and they just aren't capable of expressing appropriate emotions at the right times. You're not misreading this when I have this set here that it is a group of disorders. There are different subtypes to schizophrenia. For example, you could argue that schizotypal personality disorder could also be categorized within the schizophrenic-related disorders because it does involve kind of distorted perceptual processing. For example, perceiving that you see lights that others don't see, or can hear things that others don't hear, for example. But for our purposes, we're just going to kind of keep it as simple as we can, wrapping up this content, since I think I've done a pretty good job of overwhelming you with all of the different types of disorders you need to know anyway. And we're just going to keep it to schizophrenia, okay? So let's talk about these different breakdowns in terms of thinking and thought processes. I'm going to move myself over here for a bit, okay? So delusional and disorganized thinking. This is a quote from an actual schizophrenic patient that was interviewed and evaluated via a case study in 1982. So it says, "This morning when I was at Hillside Hospital, I was making a movie. I was surrounded by movie stars. I'm Mary Poppins. Is this room painted blue to get me upset? My grandmother died 4 weeks after my 18th birthday." Okay, so you can see how very disjointed that thought processing happens to be, and we'll talk about what seems to be the cause in a second. But there is just no stream of continuity or something that's easy for us to be able to understand what the thought processing would be there to see, to go from being surrounded by movie stars to perceiving yourself to be Mary Poppins to focusing on the color of the room and then discussing your grandmother's death. A lot of psychologists believe ultimately the reason for this kind of disjointed thought processing is due to a lack of ability to use selective attention. Those with schizophrenia, they don't have it. It's not possible for them to think selectively, much like you and I could. And so that is ultimately what results in an awful lot of their bizarre kind of all over the place thought processing. and in many respects, their inability to shut out the voices that many of them can often hear due to hallucinatory experiences as well. When we talk about disturbed perceptions with those hallucinations, I'll get into an explanation of what a hallucination is in a second, but I also want to get into hitting that third component that was referenced earlier, the inappropriate emotions and behaviors. A very common presentation of a symptom within schizophrenia is something called flat affect or apathy. It's very common for you to see schizophrenics, for example, whose responses in an emotional sense to certain situations are just not acceptable. They're not appropriate. A schizophrenic person may start to laugh, for example, when they've heard news that a family member is dying, or they might show no emotion at all, which is that flat affect component. It is just straight here. There is no up or down for them in terms of emotional expression. Now, something else to think about when it comes to schizophrenia is the presentation of symptoms. We categorize them either as positive symptoms or negative symptoms, okay? So with positive symptoms, what we are seeing is that these are symptoms that occur on top of normal functioning of an individual, okay? Or they're being added to normal functions. So this would be things like perceptual delusions, perceptual hallucinations, disorganized speech, and behavior, okay? So these are going to present in the first stages or in the earlier episodes of schizophrenia as well. That's an important distinction. So let's talk about a couple of these, individually, okay? A delusion is defined as a distorted false belief, okay? It is a tendency for a person to ignore any other kind of evidence out there with regard to a false belief that that person has, okay? So you can have any number of delusional beliefs out there within schizophrenia. There are delusions of persecution, that someone is out to get me. For example, Jared Lee Loughner, who ended up shooting up a grocery store in Arizona and striking former House of Representatives member Gabby Giffords in the head and killing, I believe it was 7 people total, one of whom was a grandchild of a woman who went to this meet and greet at this grocery store to meet Gabby Giffords. He had a belief, a delusional belief, that the government was ultimately attempting to control people's minds, and that was what fueled a great deal of his violent tendencies there. You could also have delusions of grandeur, or delusions of identity, like perceiving yourself to be Superman. You could take a look at the Dark Knight shootings that happened at the hands of James Holmes a couple of years ago. He perceived himself to be the Joker in terms of his identity, and he adhered to that for an extensive period of time. You could just have delusions with regard to obsessional tendencies as well. There is a former schizophrenic former late-night man, Dave Letterman. Her name was Mary Margaret Ray. She basically stalked him day and night for 10 years, wrote him love letters, truly believed that they were married to one another and were in a relationship. So you can have any of those things with regard to the delusional component. Now, with hallucinations, these are slightly different because these are basically perceptions that are outside of the realm of what your senses can actually detect. Okay, so the senses can't actually pick these things up. The most common hallucinations out there are auditory, particularly hearing voices in the head. But it is possible for someone with schizophrenia to have olfactory hallucinations, thinking they can smell certain things, gustatory ones, that they can taste certain things. They could also be visual, but these are far less prevalent. So when those voices tend to present themselves, a lot of times they are voices that will give orders to the person, or they are insulting statements to that person, things that insult them in terms of their intelligence, their intellect, their ability to do certain things. And that is a very common scenario. So in the case of the giving orders component, this is David Berkowitz. He is the son of Sam Killer, who was active in the 1970s in New York City. He carried out his reign of terror because he perceived the neighbor's dog to be the devil, and it was telling him to go out and kill people. definitely a hallucinatory experience for sure. Certainly not something that could be presented or picked up with regular everyday sensory processing. In terms of disordered speech, a very common presentation of this is what we call word salad. Their thoughts just lead to, because of that, that struggle with selective attention and just the degenerative effect that schizophrenia can have on the mind, they jumble their words, and so they don't seem to make sense to those of us that are listening to them. A common example of this that I used to give an intro to psychology would be something along the lines of the following. Trust the bamboo of pastrami, for the infinite monkey boy is steam my vegetables. Okay, so words are coming out, but they don't have any level of organization or order to them to make it possible for you who would be hearing them to understand them and make sense of them. There's also that disorganized behavior component. For example, the inappropriate emotional responses that are prevalent. They could act on behaviors that are considered to be inappropriate. Feel the necessity to do certain compulsive things with their behaviors, like rubbing an arm or rocking in a chair back and forth. This could be something that you would see kind of stereotypically presented in videos, TV, movies of schizophrenics, where they tend to be presented as homeless individuals who have like tics of talking to themselves or things along those lines, rooting through garbage cans, stuff like that. Now, when we switch gears and we talk about negative symptoms of schizophrenia, these are behavioral deficits or loss to normal functioning. Okay, so when we say that negative piece, it means that we are subtracting them from normal functioning. So this would be that flat effect piece that we talked about earlier. It is possible for there to be what we call poverty of speech, where their speech is especially slowed down, or there are very long lapses in their speech processes. And a lack of directedness in the sense of very slow movement and inability to participate in social situations, or a lack of interest in participating in social situations. They kind of withdraw themselves. Now, it is possible for schizophrenia to present itself in both acute and chronic ways. So when schizophrenia is very slow to develop, this is what we call chronic schizophrenia, and the recovery from this onset is particularly difficult. These schizophrenics tend to display the negative symptoms, which end up causing more difficulties with being able to function at a normal level. On the flip side of that, if you see acute onset of schizophrenia, so it develops rapidly, the psychotic break seems to happen very quickly, recovery in the sense of being able to control much of the symptoms can be far better. These schizophrenics tend to show positive symptoms. So when you are presenting with hallucinations, delusions, things like that, it is far better or far more likely in terms of treatment that you will be able to gain a sense of control, as opposed to those who demonstrate the flat effect or seem to have a very slowed cognitive functioning process. So how do we look at the cause behind schizophrenia? What's ultimately going on there? We look to the issue of the dopamine hypothesis, specifically dopamine overactivity. When we were looking at neurotransmitters back in Unit 3, you were taught about dopamine and how an oversupply of it has been linked to schizophrenia. Specifically, it's the D4 receptor site in the brain that seems to have higher levels of dopamine that get put out into the brain, and that's ultimately what ends up creating, for example, some of the hallucinatory experiences or things like that. So we do know that there is a brain abnormality out there that is connected to that. That is ultimately why antipsychotic meds ultimately attempt to go after dopamine levels. When you look at brain scans for those with schizophrenia, there is also abnormal functionality in the frontal cortex, the thalamus, and the amygdala of schizophrenic patients. And again, when you think back to some of the behaviors connected to these pieces, how the frontal cortex deals with things like judgment, emotion, impulse control. The thalamus is responsible for sensory relay information. Amygdala is responsible for emotional responses. It makes sense then that these brain structures may be off in terms of an abnormality component, that can contribute to some of the schizophrenic symptoms that are demonstrated. When you look at the brain scans here from these MRI scans, and you look specifically at areas called ventricles. Sorry, I'm just now sitting down at the end of my day, and so whenever that happens, I start to feel a little sleepy. When you see these ventricles and you look at the scan of a non-schizophrenic versus one who does have schizophrenia, notice how large that ventricle is in someone with schizophrenia. So it's possible for schizophrenic patients to show changes to their brain in terms of matter and physical structure due to that ventricle. And there could be some components that present there for causing some symptoms. So to kind of look at this stuff a little bit more in depth, the hallucinations connect back to too much activity in the thalamus, that sensory relay center. So they're picking up all of the sensory information that isn't actually present. And so when we look at abnormality in the frontal lobes as well, that stuff we already kind of talked about and hit on a little bit. It's also important to look at the significance of the hippocampus. Oh my gosh, I'm so sorry. I can't stop yawning. The worse the disorder is going to present itself, the more that the shrinkage presents itself in both the hippocampus and the amygdala. When you look at the fact that the hippocampus is responsible for things like memory and some aspects of other cognitive higher level functioning, that again kind of makes sense in terms of a deductive link that you can make. If the thalamus is small in a schizophrenic, this is ultimately what we perceive to be part of the greater difficulty in filtering information that's out there, and that schizophrenics are being bombarded with. So ultimately, that these are all brain structures that one has to take a look at. Maybe if I stop trying to hold it in, that will help offset it. So when you look at all those physical changes for things, then that's a pretty big cause to stuff. Here's the next question that you have to ask yourself then when you look at all of those brain abnormalities. What led to those abnormalities in the first place? Well, there is some corollary link between mothers who caught the flu in their third trimester to the development of schizophrenia later on in those children. There have also been connections via correlation to low birth weight and birth complications. Okay, if there was difficulty with regard to oxygen getting to the brain, for example. All three of these things have a corollary link. Now, obviously, correlation doesn't mean causation, but all of these things could be in some way, shape, or form connected to that later brain development into adulthood. We do know that, genetically speaking, schizophrenia is highly, highly heritable and very heavily linked genetically. The likelihood of somebody who has an identical twin getting schizophrenia is 50%. So if your identical twin had schizophrenia, you got a 50-50 shot of developing it yourself. In your textbook, for example, you were introduced to a group of quadruplet girls who all ended up developing schizophrenia, and they were identical quadruplets. So the likelihood of that happening is very, very, very substantial, which supports a very significant genetic link. And here's the other thing that connects with this. You can take out the nurture component to an extent because this prevalence within identical twins is seen across culture. Okay, there is some heightened level of fraternal twins also getting that development. Excuse me, there's the yawn again. Of schizophrenia as well. It's not as high as identical twins, but you can see from this graph that regardless of cultural implications, genetics do play a pretty critical role in the presence of schizophrenia developing. Now, that's not to belittle environmental factors that can trigger schizophrenia, because that absolutely can. Here are the Janine sisters, who I made reference to just a second ago from your textbook. They're all identical, and they all ended up suffering from and developing schizophrenia. So there are contributing environmental factors. You know, while genetics play a role, it's possible for stressful life experiences to create the psychotic breaks that can end up occurring in adulthood and in adult life. So don't discount environmental factors, because those can still very heavily play a role in things. So what are typical early warning signs for schizophrenia presenting itself in people? Early warning signs for the possibility of someone developing it is if a mother has schizophrenia and it's particularly long-lasting. Any scenario of oxygen deprivation, low birth weight, birth complications, exposure to the flu in the third trimester. If you see a person demonstrating a very significantly short attention span and poor muscle coordination, that can be an early warning sign as well. Disruptive or withdrawn behavior, emotional unpredictability, poor peer relations, and solo play. Here's the problem. If you've been thinking to yourself as I've gone through and listed some of these, wow, these sound an awful lot like some other earlier disorders we've talked about, you're right, they do. And so, in many respects, how do you identify the development of schizophrenia earlier on, rather than a possible misdiagnosis of something else like ADD, ADHD, some kind of personality disorder that involves. Sorry, there's yawn again. Oh my gosh, this is so bad. I'm so sorry. To kind of try to bring this back and end all of our misery here. Poor relations and solo play. Maybe it's a personality disorder of something like schizoid or schizotypal. It's really hard to be able to identify these earlier warning signs and not misdiagnose them as something else that could be going on for the person. So this was the end of these schizophrenia notes. Hopefully you got some smiles out of my struggle to deal with my yawning as I sit down here and do this video for you. And hopefully it wasn't too terribly distracting at that. As always, if you have any questions, just let me know, but you are officially finished with disorders content, and your next video is going to be on therapy treatment.